Alright, now we're gonna do the skill demonstration for medication administration. I don't have a meter dose inhaler, but I'm gonna assimilate like I have one. So, okay, so I'm gonna knock. Hello, my name's Lorena. I will be administering your medications today. I'm gonna wash my hands for at least 20 seconds with soap and warm water. Can you please verify your first and last name and your date of birth for me? Alrighty, sounds good. I'm gonna make sure to provide privacy, close the door or the curtain if it's the case. I already explained what I'm gonna be doing, which is administering the medications. I'm gonna access my electronic medical record, which I'm gonna simulate that it's right here. And I have to make sure that I have the right patient, that I have the right medication, the right dosage, that it's the right time to give it, and the right route, either by mouth or if it's like a cream or whatever the case may be. Make sure that my medications is not expired. Also check on my MAR for any allergies of my patients so that I don't cause anything wrong on that. And if I need to take like a pulse or blood pressure before I administer the medication, if it's required, then I will make sure to do that beforehand. So first off, I'm gonna compare the medication label with the EMAR to make sure that I have the right medication and the right dosage. The second time that I'm gonna verify my medication is when I actually set it up in the cup. I will check it again to make sure that I have the right medication. And then the third check will be when I'm administering it. I will have to recheck it again to make sure that I have the right medication one more time. I have to also make sure that I don't come in contact with my hands for the medications, that they need to go from the bottle to the little cup. The other thing is that I cannot have the same all of the medications in one cup if some of them need to be verified beforehand for the pulse or the blood pressure, as if I get the blood pressure or the pulse and I have to hold the medication, then I would have to remove it from the cup, and that just makes it easier. I will also make sure to have water for my patient to make sure that she can take her medication. And I have to make sure that I stay and watch my patient take her medication. I cannot just leave it in here and then leave and assume that she will take it, because there's a risk that she can drop it, that she'll forget, or that it'll just, go everywhere. I also have to make sure that after I give my medication that I document the time that I give it, the route, and initial it. And if I need to do a second check for effectiveness, then I can also do that later on. The one part here that comes is the meter dose inhaler, which I don't have, but then I would perform the same thing for that one. I would do my first check when I look at my MAR and the medication level to make sure that I have the right medication, route, dosage, time, and route, and my right patient, of course. The second check, I would do it when I am actually preparing the medication and grabbing it out of my med cart or whatever the case may be. And then my third check will be when I'm administering it for my patient. So my patient's already sitting in a position for the inhaler. I would shake the inhaler or have my patient shake it a couple of times before she actually takes a deep breath for it. There's always a mouthpiece connected to the inhaler, so she would have to remove that beforehand. And if it is a new inhaler, you have to push it once or twice before you actually take a dose of it. Inhaler must be held 1 to 2 inches away from her mouth, and I will have to ask my patient to take a deep breath before she takes the inhaler, and then she will then take on it a slow inhale and deep through her mouth to get the medication. And just have my patient breathe slowly for 2 to 3 seconds and then hold her breath for at least 10 seconds to make sure that the medication is in her system. And I will also make sure that I document that. The other part here is the subcutaneous injection, which I don't have, but we're just gonna simulate it and make sure that we get that. So again, with any of the medications that I administer, even if it's just an injection, if it's a cream, if it's just whatever the case may be, I have to do my 3 checks, which be the EMR, label and compare, make sure that I have the right patient, right dose, right time, route, and the 3rd check would be when I'm administering the medication with my patient. So for the subcutaneous injection, I would, make sure that the area is exposed. I would locate it and clean it with an antimicrobial wipe in a circular motion from the middle outward 2 inches, and allow the skin to dry. So I'm just going to simulate that I'm going to do that. I'm just going to pretend that I'm going to do it here. And it would just go 2 inches away from the point where I'm going to be administering it. Before this, I would of course make sure that I don my clean gloves, but I don't have a pair of gloves here, but it's just what I'll do. And I will uncap the needle and gently grasp the tissue and insert the needle quickly at the correct angle. So it's just a quick pinch and then do the right angle at it. And after that, I will release the grasp and stabilize the syringe and slowly inject the medication. So after that, I will withdraw the needle at the same angle that I applied it with, and make sure to apply a cotton gauze if there's any bleeding, and activate the safety device on the needle and discard in the sharps container, not the regular garbage can, and apply an adhesive bandage or a band-aid. And then after that, I'll just document it, make sure that I document that I did it in the left upper arm and the time that I did it as well. For the intramuscular injection, it would be the same thing, but the only difference would be sorry about that. And for the intramuscular injection, it would be the same thing, except that that we would pull the skin taut with the forefinger and the thumb on non-dominant hand and insert the needle at 90-degree angle. So for the first one, the subcutaneous injection is just a little grasp, but for the intramuscular, it's actually like a pinch, and it would be just kind of like a dart motion, like